you.
What's going on, you guys? It's your boy Tochi. It is Thursday. It is 6:51 a.m. and I am here at my hospital in Oakland, California. I am doing another vlog, but I'm doing it in a day in the life format. I know for the psychiatry rotation, even for the first week of this rotation, I've been doing the week in the life format. But even just this week, this is the first time I've touched my camera, and I just realized that the more busier I get, the less time I'm gonna actually have to like vlog. So the days that I do feel that I can actually record material, I'll just put in like a day in the life format instead of like a whole week's worth of material, which I don't even have right now. So I'm gonna be switching to that. I hope you guys enjoy that as well. You guys can let me know which one you prefer, but for now I'm gonna be doing day in the life videos. Currently I'm waiting for my head resident to come in. She's going through all the patients that are coming in that are gonna be assigned to our team. So she's looking throughout the list to see what patient would be appropriate for my level as a third-year medical student, and they're gonna assign it to me. I'm gonna go follow that patient, do a full history, do a full physical exam, and then write up a note for my head attending for me to do an actual presentation. I came in this morning, and usually when we come in on the mornings, we go to the night team and check out the sign-outs and see the patient that we're following the previous day, because when I get off my shift around like 5 or 6, it gets handed off to the night team who stays here overnight, and they follow that patient and you know just make sure that nothing really major goes on, and if something does major go on, then they let me know when I come the next morning. And I went this morning, and my patient that I've been following since Sunday just got discharged, or pretty much to let you guys know that aren't in med school, that just means that they've been released from the hospital and where they're no longer under our care. I'm gonna go to my room right now and go meet up with the rest of my team, and then I'm gonna see what patient I get assigned and then go meet up with them so I can do a full history and everything. So I'll catch up with you guys later. So I just got assigned my patient by my head resident, so I'm gonna show you guys what I do whenever I get assigned a patient. And right now I'm gonna start off by showing you guys my template for what I want to ask and the information that I want to gather for my presentation for when I present to my attending after I meet with my patient. Okay, so here's my template. So basically what I do first is that I get their name, their age, the room number that they're in, and their ID number, which is their medical record number that they are assigned to when they get placed in this hospital. And after that, I go to that CC, which pretty much means chief complaint. That pretty much is in their own words why they're here in the hospital. That plus and negative sign is just a pertinent positive or pertinent negatives. Those are just quick questions that I ask them to kind of like narrow down in my mind why I think they're here and what issues I think that they're dealing with. But then I move on to the HPI section, which has OPQRST. There's a whole bunch of other formats that people use, but this is the one that I like. O pretty much means onset, P means pain. That is where they kind of describe to me the pain, if it's sharp, it's dull, if it's like diffuse, if it's in like one specific area. And then I go to I go to Q, which means quality. Quality, they rate the pain kind of like 5 out of 10, 10 out of 10. They kind of just let me know what type of pain it is, pretty much how they're feeling when they first had this issue and when they're presenting now. R means related symptoms. So if they have like say a heart attack, I ask them like, whoa, what's going on? Focus for me, please. I pretty much ask if they're having like chest pain, if they're feeling like dizzy, things like that, just related symptoms to when they had this original issue that they came in with. S is setting, and then T is transforming factors, which pretty much means if anything makes it better or worse. Why does it keep unfocusing? Come on now. And after all that, I go to past medical history, which I ask if they have current conditions that they're dealing with, like diabetes or anything else like that, asthma, previous hospitalizations, allergies, baseline, which is pretty much how they were before they got this issue, and then surgeries, if they have any past medical surgeries. And I go to their family history, and I pretty much ask like how their parents are, how their siblings are, how their children are. I go to sexual history, that's pretty self-explanatory. And then I get their home meds and their hospital medications. And then after that, I go to their social history, occupation, relationship status, travel. But the most important is like smoking, alcohol, illicit drugs, things like that. And then you guys can see the rest of them there. Then after all that, I go and get their vitals. So that is the stuff I get on the computer system. I get their temperature, heart rate, blood pressure, etc., etc. Respiratory rate, O2 sat, urine output. This one one is physical exam. So I go through every single physical exam. I check their heart, their lungs, their abdominal system, their extremities. I check their general appearance. I do kind of like a small psych exam just to kind of show how oriented they are to their condition and to their state. And then after that, this is just more information I get myself. This is just like a fishbone chart. I document their sodium, their potassium, and all those things in there, BUN, creatinine, glucose, and then I get their hemoglobin, white blood cells, platelets, and then their hematocrit levels. Then after that, I go and get the important studies, which is pretty much like x-rays, CT exams, and I pretty much describe what it says in there. And then after that, I have a problem list and assessment plan, and I pretty much list out every single problem that they have, what I think it is, and how I'm gonna deal with it, and how I'm gonna follow up with it. And then after that, I do a to-do list, which is pretty much what I wanna follow up on for the rest of that day, and then kind of just like, you know, check them off to make sure that I did them. So that's pretty much like quick abridged version of my template for doing these interviews every single day. That is the template that I use, and then I also have another one for progress notes. I'll show you guys that in another day in another vlog for when I'm actually doing it. But if I'm meeting a patient for the first time, that's what I'm doing. So a couple of updates. I just had my meeting with one of the attendings here, and then I also had a lecture on hypertension. For my meeting with the attending, it was really good because he was able to give me some constructive criticism on the H&P that I had for my first week here at Highland Hospital. He said it was a good start, but he can definitely use some work. He said that making a good H&Ps is kind of like a special art. It's something that doesn't come easy. It takes a lot of time to master, and he said that this is going to be one of the main things that they want us to learn while we're here in the hospital internal med rotation, is for us to do a good H&P. So he went through my whole H&P, and he was pretty detailed with it, which I highly appreciate because I really want to know how to do well with these H&Ps. It's very important for us to write these because it pretty much lets every doctor know about the full history of the patient, and it kind of guides our mind and our thinking to letting us know what we have to do to treat this patient. So he went through the whole thing. It took about an hour. It was a lot of good information, and I feel that I can take that information to now make a better H&P for next week for what I'm going to be turning in, because we have to do one for every week, and he's going to be going through it to make sure that we're getting better and better at writing them. We then had a lecture on hypertension, which was again another hour. It was nice kind of recap on hypertension. We have lectures pretty frequently, and they want us to be pretty knowledgeable about these things for rotations. They really want us to know how to diagnose and how to treat people with these conditions. But before that, in like step one in a med school, they want us to know how to identify these conditions. So now that we already know how to identify these things and we showed that we can do it on step one, they want us to know the guidelines and how to treat it and what we're going to be doing, because there's certain complications that can arise when we're treating these things. And clinical medicine is a lot different from like medicine in books, you know what I'm saying? So right now I'm gonna go meet up with my team, see if there's anything else I have to do. But if not, I'm gonna head home and study, because tomorrow is another day off and I really need to catch up on my studies. So I'll see you guys in a little bit. Finished off my shift for today. It is Thursday. I'm going to be having tomorrow off. They gave me tomorrow off specifically because I have the whole weekend to work. So it's called the Black Weekend for us, where we have an on-call day on Saturday and then a post-call day on Sunday. So we can't miss any of those days. So they're like, all right, you can pick a day off, and I picked Friday because I don't want to have like, you know, 3 days in a row from like Friday, Saturday, and Sunday to work. I just wanted to, you know, kind of rest my mind before I work the whole weekend, because I've never really worked a whole weekend like that before. But anyways, I finished my shift for today. I'm going to be heading home, doing a little bit of studying. I have a whole bunch of Anki cards that I didn't get to touch that much today. And then after that, so I'm just going to enjoy my day off tomorrow, catch up with some studying, and then prepare for the firecracker quiz that they're going to be releasing on tomorrow, actually. So I'm going to do all that, and I'll keep you guys posted on the next day in the life. So I'll see you guys later. Peace. Have a nice day.